everyone. I'm Alana Thompson. I'm a massage therapist in Cochrane, Alberta. This presentation is on jaw dysfunction. There will be contact info at the end. Please, if you have any questions, feel free to get in touch. I always love talking about this stuff. So I also want to preface this by saying all of this stuff is complex. I'm going to use the word complexity a lot in this presentation, and I want to try to deliver the message that I'm not trying to oversimplify this or say, if you just do a little bit of self-massage, all of your problems are going to go away. But on the other hand, I do think that treating the jaw can be very effective for treating a lot of other conditions in the body as well, which we'll talk about throughout the presentation. We're going to get to a lot of self-care. I actually really believe that the work that you do on your own body is really where the power is. Massage is great. Obviously, I believe in that. But you don't have to see a massage therapist in order to make a difference on your jaw clenching or whatever is going on for you with your jaw. So I am going to use the term TMDs here, temporomandibular disorders, as opposed to TMJDs, because it's not just a dysfunction of the joint itself, but jaw disorders are now considered a complex multi-system disorder. There's so many connections to the rest of the body from the jaw, and we'll talk about that. Okay, so jaw dysfunction can be acute, meaning it's happening fairly short term. It just happened to you. Maybe you got hit in the face with a volleyball or something like that. And right now your jaw is sore, but you don't have a long history of jaw problems. Or we can be dealing with a chronic dysfunction where you've had jaw problems for a really long time. Some people have painful jaw dysfunction, some people don't. So along this continuum, chronic and painful are going to present more severely. You're going to get more of the other types of symptoms and other types of body problems that we're talking about. Not all acute jaw dysfunctions turn into chronic. Not all non-painful jaw dysfunction becomes painful, but we have the potential of moving down that continuum. Things we want to talk about: abnormal opening and closing. So if you feel that the jaw is weird when it opens and closes, you get clicking or locking certainly is a big risk, or the jaw catches a little bit when you open, especially when you open fully. Some people will say, I can hear sounds in my jaw when I'm eating all the time, or when I'm talking, when I yawn, it feels really vulnerable. So when we don't have any pain associated with clicking and catching and things like that, it's not necessarily a big problem, but abnormal movement in a jaw can lead to early degeneration in that jaw. And with a lot of other joints, I wouldn't be overly concerned if somebody says, oh yeah, my knee pops every time I bend down. If that doesn't hurt you, I'm not usually concerned about that. With the jaw, I am a little bit more concerned about those abnormal things going on, just because I've seen how connected the jaw is to the rest of the body. And if we can get the jaw moving smoothly and centralized and decrease the potential of having you develop a TMD over time, I think that's really beneficial. So if you've had a lot of dental interventions or a lot of jaw trauma, that can also lead to TMDs. If you are noticing a bunch of symptoms in some of these other conditions that we're going to talk about, and you don't yet have jaw dysfunction, we can treat these in other ways, and we can always check the jaw to see how it might be contributing to other things that are going on. If you clench your teeth at night or grind your teeth at night, or some people clench or grind during the day as well, this is considered part of the TMD presentation. So you've got a lot of tension building up in the jaw. That's definitely worth addressing. So you don't have to have the abnormal opening, closing, clicking, or locking in order to be considered to have an issue with your jaw. So like I said, very complex. I'm going to go through each of these factors here before we get to our self-care. So this is an important message to deliver. A lot of people who have, especially chronic TMD, have tried a lot of things before, and it can be difficult to get good care. So we're going to talk about some of the reasons why that is. So anatomically, we've got these two joints that function together, and this is pretty unique in the body. The muscles are very strong. Some of them are pretty weird. They operate in different ways at the jaw than muscles that we see surrounding other joints. The movements of the jaw joints specifically are unique. So we don't have just an opening and closing, but we also have this roll and glide that happens at the jaw joint. So having the jaw move in a correct way is maybe more difficult than it would be for other joints. We have a lot of connections to some important cranial nerves, and we'll discuss that. There's really powerful connections from the jaw to the skull and the upper spine. Even something as simple as, you know, when you get on an airplane and your ears feel like they need to pop, so you open your jaw in order to pop your ears, right? So the positioning of the jaw affects the size and positioning of the ear canal. And that can affect things like balance, for example. So lots of powerful connections in there, and lots of those connections are well beyond my understanding. I just know that often treating the jaw will change some of the things that we're trying to get change at that we can't get change in other ways. The other reason we've got some complexity here is there's a lot of functions associated with the jaw that are pretty important. So we've got basics like breathing and eating, but both are a lot more complex than they appear. So something as simple as breathing, the position of the jaw affects the way we breathe, affects the position of the airway. So if any of you have taken a first aid course and you've learned to do this jaw thrust, like bringing the jaw forward in order to open somebody's airway, you are obviously aware that the position of the jaw affects the ease of breathing and the opening of the airway. So some of us, if we're not breathing especially well, with high stress levels, we might start breathing mostly from our upper lungs. Our breathing can feel a little bit restricted. We might start positioning the jaw forward like this in order to ease our breathing. So when we bring our head forward and we bring our jaw forward in order to make our breathing better, we're going to impact a lot of other muscles and a lot of other functions throughout the neck and the shoulders especially. And breathing is much more than just bringing air into our lungs and then exhaling that air again. We know that the way we breathe affects our stress levels, the functions of the diaphragm associated with breathing. The diaphragm connects to a lot of other muscles. We can talk about rib cage mobility and spine mobility. So breathing properly is important for a lot more than just bringing in the gases that we need and getting rid of the waste products. Same with eating. So eating is a lot more than just fueling our bodies. We have a lot of social connections associated with eating. Gut health, we know more and more about how important it is that the bacteria in our gut is really healthy. And so if eating becomes difficult, if, say, you can't chew on raw vegetables, then you'll probably start eliminating those from your diet, which has these other far-reaching effects. Sometimes when people talk about the effects of having a painful chronic TMD, they say things like, I don't go out to eat with my friends anymore because eating's too painful for me. And it just is a stressful experience. So now we start losing out on social connections as well. And then I think we can extend this sort of parallel between simple functions to their more complex roles with things like speaking, expressing intimacy, and smiling. So if it hurts you to talk because your jaw is so sore, then you're going to do less of that. So again, less social connection, that the sort of metaphorical not having a voice, right? Not feeling like you can speak up for yourself, or maybe you have an important meeting coming up at work and that's going to be a hugely stressful experience for you because you know how painful it's going to be. You might then try to make your speech briefer so that you're not in so much pain, and now you're not being able to express what you need to express to, I don't know, stick up for yourself or achieve the goals that you're trying to achieve. If we're, using our jaw for kissing or telling our family that we love them, that expression of intimacy can also start to become curtailed by the pain that we have at our jaw. Same with smiling. Moving our mouth in a particular way starts to become painful. We stop doing that. And that can affect things like our self-confidence. It can affect how people look at us and our interpersonal relationships. So having these long-term chronic problems at the jaw can be really life-altering. And I'm especially concerned with trying to help people address those quality of life issues that come from having that regular pain and tension at their jaw. Okay, the presentation of disorder and the symptoms we get can be varied and diffuse, meaning, spread out across the body. We often have a lot of different practitioners involved in our care and diagnosis. So maybe you are seeing a dentist, maybe you're seeing a nutritionist or a dietitian, maybe you're seeing a manual therapist, maybe you're seeing a speech practitioner, maybe you're seeing a psychologist. So a lot of these different practitioners, it can be very expensive. you can get to the end of care with somebody. So whoever is treating you in one way can say, okay, like, I think we've sort of accomplished all that we can accomplish here. You don't feel like the whole condition is resolved, but that practitioner has sort of given you as much as they can in terms of their skill set. So it can feel like abandonment in that case. And a lot of people with TMDs talk about how they do feel abandoned by their healthcare practitioners. And then we have all of these other comorbid conditions that we're going to get into in a second. Comorbid just means existing alongside of another condition. We have a lot of interactions with our vagus nerve and our autonomic nervous system. So we can end up with autonomic nervous system dysfunction because the nerve that activates the muscles of chewing and does all of the sensation for the face, the jaw, and the scalp, that's the trigeminal nerve. And the trigeminal nerve and the vagus nerve are very tightly connected anatomically. Nervous system structures that are very close to each other influence each other very strongly. And so we can get vagus nerve dysfunction associated with jaw dysfunction. It's very common. I'm not going to spend a long time on vagus nerve dysfunction here because there's whole other workshops on that. But the vagus nerve drastically impacts the functioning of the body, our relaxation nervous system, the validity of communication from within our body to our brain, and also our gut-brain axis. The vagus nerve is also our most powerful inflammatory regulation in the body. So if we have a lot of chronic inflammation, the vagus nerve isn't functioning well because the trigeminal nerve is irritated or inflamed, then it's very difficult for our body to manage the inflammation that's going on. And that can explain some of these other conditions that come along. So 85% of people with TMD have another condition. And those conditions can be painful or non-painful. The list is quite extensive. So I'll show you this list. I'm not going to go through each of these separate conditions here. But I just want to point out some connections here. So we have a lot of inflammatory type conditions going on. We have a lot of conditions that exist in that sort of autoimmune dysfunction, difficult to diagnose, difficult to treat, things like chronic fatigue syndrome. Ehlers-Danlos is a hypermobility syndrome, which is probably not caused by the jaw, but probably rather the hypermobility that exists in the body is affecting the jaw function. And that's part of the, again, complexity here is that we can't necessarily say that jaw dysfunction is causing these other disorders, or necessarily these other disorders are causing the jaw dysfunction. Sometimes there seem to be pretty linear connections one way or the other, causation-wise. Sometimes there's probably another condition that is causing both of these things, both the jaw and whatever other condition we have here. But there's a lot of influence from the jaw. And in some studies, and some practitioners have found that when they treat jaw dysfunction and jaw pain and jaw tension, the symptoms of other conditions improve. So that's something I try to be very careful about in my communication. I don't make promises that if we fix your jaw dysfunction, your irritable bowel syndrome is going to disappear. However, I do think that you will notice improvement in the symptoms of your IBS if that's the other condition that you might be dealing with. And in some senses, just because the nervous system has relatively limited capacity, and the more things the nervous system has to manage, the more complex our symptoms seem to be, and the worse those symptoms seem to be. So, excuse me, if we can eliminate or reduce one of the things the nervous system is managing, it has more space, more processing capability, more ability to manage other symptoms in the body. So if you're looking through this list, you might be noticing some things that feel familiar to you. There's a few that have asterisks beside them, and those are especially common, along with jaw dysfunction. There was a big study done in 2006. It was a predictive study. So they took people who did not have jaw dysfunction at the time of the study, and they classified all of the other things that were going on with a variety of other symptoms. And then they looked at those people over a length of time to try to figure out what was predictive of people developing jaw disorders later. So some of the things that came up as being very predictive were headaches, somatic symptoms like tinnitus and vertigo, dizziness came in there. IBS or any other digestive complications. Genital pain was on there. And then a self-report of something weird happening at the jaw. So the person saying, my jaw feels weird, is more predictive of them developing a TMD later on than a clinician's diagnosis of their jaw dysfunction. Okay, so we do have some pretty strong connections from the jaw to the brain anatomy and structure. So when people have chronic and painful TMDs, they are more likely to have changes on functions and structures in the brain. So the structures that are involved in mood disorders like depression and anxiety, and the structures that are involved in the pain classification and management in the brain, when we look at people with chronic and painful TMDs, they have changes in the structures and functions of both of those categories of mood disorder and pain. And in some studies, so it's difficult to do these studies on people, but in animal studies, they've shown that inducing painful jaw dysfunction causes changes in the brain anatomy and structure and function. Reversing those changes at the jaw also allows the brain to revert to its normative structure. And there was a human study in people with knee osteoarthritis, so another chronic pain condition, where post-surgery, so successful surgery where the pain was dramatically reduced, the changes that were present in the brain reverted back to normative. So again, I'm not saying fix your jaw and your depression goes away, but I am saying that the nervous system is very connected back and forth from the body to the brain, and pain and mood disorder functions together. So people with chronic jaw pain and another chronic pain condition, those chronic pain conditions interact with each other, making each other worse. So the jaw pain makes the fibromyalgia worse, the fibromyalgia makes the jaw pain worse, and that relationship exists with mood disorder as well. So chronic painful jaw dysfunction makes symptoms of depression and anxiety worse, and mood disorder makes the symptoms of jaw pain and dysfunction worse as well. I do want to make a quick mention of heart disease here, both from a couple of perspectives. So the bacteria that causes plaque in your teeth is the same bacteria that causes plaque in your arteries. That bacteria and that plaque can travel from the gums through the circulatory system and get into the arteries and the heart. So dental care is a really important part of overall health, specifically heart health. But the other thing is that tooth pain, severe tooth pain, can be a symptom of heart attack, especially for women. So if you have tooth pain that sets on quite suddenly, especially if it is associated with shortness of breath or, sort of a gray tinge to the skin, a lot of sweating, severe exhaustion, those kind of things shouldn't be ignored. So if that tooth pain is really concerning to you, please make sure you get it checked out right away, because we don't want to mess around with the potential that it's a presentation of something that's going on with your heart. Okay, so body pain and headaches. So chronic pain throughout the body, like we just said, can be affected by the presence of pain at the jaw. The other thing that's interesting about this is that so the rest of the body sends pain signals to the brain via the spinal cord. The face, the jaw, and the scalp have a special pathway directly into the brain that transmit the pain from those areas directly into pain processing centers in the brain, and that's through the trigeminal nerve. So the whole rest of the body is using the spinal cord, the jaw is using its own special pathway. So we get a lot of connection between jaw pain and headaches. One of the major causers of headaches and migraine is jaw dysfunction. And that's partly because of that trigeminal nerve interaction. The places where we feel pain in the brain, so brain tissue itself doesn't have pain receptors, it doesn't feel pain, but the linings of the brain can. Some of those linings of the brain do, and the nerves that contribute to those pain sensing areas in the brain are the trigeminal nerve and the optic nerve. So jaw and eye, those are the only two nerves that are delivering pain sensation into those parts of the brain that do actually experience pain. There's also a lot of connections to the neck, the shoulder, the hip, the pelvic floor, the low back, and even the feet. So there's connective tissue that travels throughout the body that connects a lot of far-flung areas of the body. So the connective tissue from your feet actually travels all the way up through your inner legs, into your pelvic floor, through the abdominal area, into the throat, the jaw, and the tongue itself. So there's some really strong connections there. Sometimes the jaw dysfunction can be impacting things like plantar fasciitis. The jaw and pelvic floor connection is quite interesting, and this is something you can try right now. When you increase tension in the jaw and the throat, so if you clench your jaw, you also typically, almost everybody does this, clench with your diaphragm and your pelvic floor. So if you sort of tighten up through the back of the jaw, so you can try just clenching your teeth and see what happens. Just pay attention to what's happening at your pelvic floor. Most people are going to notice an increase in tension at that pelvic floor. The place I notice it especially is, I call it closing off the throat, like the start of a swallowing movement. That increase in tension throughout the back part of the jaw here definitely impacts the tension that people experience at their pelvic floor. Pelvic floor tension, chronic pelvic floor tension also affects the way the hip and the low back are going to function, the way they move. So often we get this chronic pain happening because of the buildup of tension in these areas. And one of the ways I look at this, I tend to look at things through a nervous system lens in terms of what is our body communicating to our brain and what is our brain communicating to our body. So holding on to tension in the body, if we have our jaw clenched, that is sending a signal to our brain that we must be stressed, right? That's one of our sort of first stress sensations is we'll clench at our jaw and we'll bring our shoulders up. So when our brain tells our body that we're stressed, that muscle tension is going to increase at the jaw, the neck, and the shoulders. But it goes the other way as well. When we have chronic tension in the jaw, the neck, and the shoulders, we're sending this sort of continual message to our brain that we must be stressed because we're holding on to this tension. So muscle tension, muscle guarding increases our stress response. An increased stress response increases muscle tension and guarding. So we've got this lovely little vicious circle going back and forth that can be difficult to interrupt. The positioning of the jaw will also affect the positioning of the neck. And without getting too sort of complicated in this, if you think about, you've got muscles in the face, the forehead, the side of the jaw here that are responsible to close the jaw, to bring it upward. You have muscles down below the jaw through the bottom of the chin and down through the neck and into the collarbones and shoulders that are responsible for opening the jaw. So when we, for example, position our head forward on our body, which many of us do if we're holding our head forward, maybe this is because of our need to reach forward and look down at things like we do all day long in our jobs and all of our hobbies, or whether it's to increase our breathing or for whatever reason we're doing that, holding the head forward will change the way the muscles in the front of the neck are acting. If these muscles have shortened because we're bringing our neck forward like this, we've increased tension along here, they will be acting on the jaw to open the jaw. We're not going to walk around all day with our jaw hanging open. So the jaw closers, the sort of clenchers of the jaw, have to increase their tension to counteract this increased tension in the front of the neck. Anytime we change the position of the jaw, the skull, the neck, we're also going to affect the positioning and the way the muscles are functioning at the shoulder. And shoulders are required to stabilize hips. So your left shoulder stabilizes your right hip and vice versa. So if the shoulder is functioning in a different way, its opposite hip can also be functioning in a different way. And so now we've got these connections from the jaw, down through to, say, hip mobility and strength. So it does get a little bit complicated. There's a lot of ways that we can test for this in the clinic, and try to determine whether, the jaw is a major contributor, either via the tension that's building up, the influence on the vagus nerve possibly, or these more structural biomechanical connections that are sometimes pretty important to people. Okay, so difficulty of getting quality care. We have this lack of coordinated care and potential abandonment. No clinician intends to abandon a patient or a client, but we do sometimes just get to the end of our skill set or the end of our ability to help somebody, and a responsible practitioner is not going to continue to treat you and take your money, telling you that they're going to continue to get results when they can't get any more results. So sometimes that's part of effective communication, is to say, I think we've made the change that we can change. I don't think we're going to get any more significant change here. I'm happy to keep treating you for relaxation or other conditions that are going on in the body, but I don't think we're going to see a lot more change at the jaw with the skill set that I have. So we're going to need to find you another practitioner. It can be difficult just with the amount of time people have to have good coordination. And this is something I know from the other practitioners I talk to, we care about this. We try to have good referral networks. We try to work with other practitioners, but it is difficult to do that. So that lack of coordination, people tend to be quite siloed in the way they treat. That can be very difficult for patients. A lot of these procedures or treatments can be expensive. Some of them are quite invasive, and we might not have the coverage, the finances, the time, or the willingness to have really invasive procedures done. And then also, if we have chronic and acute or chronic and painful jaw dysfunction, and we're dealing with all of these other comorbidities, it's exhausting. It's exhausting to be a chronic pain patient. It's exhausting to go from person to person with everybody's, hopeful answers for you. You should do this, you should do this, you should do this. And you've tried all of those things and not had a lot of success. So that I think is part of the difficulty of this, is you're not probably just dealing with a jaw dysfunction. You're dealing with the management of all of these other potentially painful and life-altering conditions. Okay, so I'll talk a little bit about treatment. The way I treat, and I'm going to give you some self-care stuff that you can put into practice right away. And I really hope that it will help. I've had a couple people say that they were able to watch the workshop, started practicing the exercises right away, and did notice a significant difference in their jaw. So that's thrilling to me. I love that people get change. So my bias is towards nervous system safety. I think the safety of the nervous system determines so many things about our presentation of symptoms, even, things as simple as movement patterns and pain classification. So I think that we get change better and we keep it longer if the nervous system is willing to accept that work. If the work feels like a threat, we tend to tense up against it, or revert back to our original patterns because that change feels too drastic or too invasive. So jaw treatment, especially if it's intraoral, so inside the mouth, can be pretty intense. And what we learn in school is really these muscles don't get touched very much. They're very sensitive. Your work is going to make a big difference. So get in there, do it. It's going to be painful, but not for very long. And then people will feel better afterwards. And that for a lot of people is true. My population of clients tends to have pretty elevated nervous systems. That may be why we get along so well, because I also have quite an elevated nervous system. And so I don't like causing people pain. I also think that the continuity of care, like consistency of jaw treatment, is quite important at the start of treatment. And so if someone comes in to treat me and the treatment is really painful, they might feel better afterwards. They might not. They might not keep that change if it's really painful, but they're way less likely to come and see me again. So I went to another practitioner to learn how to do my treatments much more gently. So now we just modify things based on the patient. Sometimes I have people who say like, no, I want much more pressure than you're giving. It feels good to me. And so we can try that and see how they respond to it. But my default is to start quite softly with this work. Same thing with self-care. This does not need to be painful. Much like, imagine that, you're going to stretch your hamstrings. We all know the difference between a stretch that feels too easy, a stretch that feels like it's nice, it's challenging, but there's no pain. And then that feeling when we push too far into a stretch and our body sort of rejects that and we tighten up against it and we think, oh, that felt really bad. So we want to keep our self-care in the very acceptable range here. You can get stretching sensation, you can get a little bit of we call it therapeutic discomfort, but we never want the level of pain where you're thinking, oh, I got to stop doing this pretty soon because this feels horrible. So self-massage, we can do this to muscles, we can do it to nerves. When we treat nerves with massage, we're much, much more gentle than when we treat muscles. So I'm going to show you that nerve treatment first. There's a couple of things I like here, and then I'll show you how to treat some of these muscles. I'm not going to get into all of the muscles at the jaw because some of them are a little bit tricky to locate. There might be other structures around there that we do want to be sensitive towards and much more gentle towards. And my experience is that most people work pretty aggressively on themselves. And so, if you happen to be sitting right over top of a gland or something like that, and you're digging into it thinking it's a muscle because it's giving you a little bit of pain, I don't want that for you. So I'm going to show you some of the main ones that are pretty safe to treat that you can just get into on your own. As always, when you're watching an educational video, this isn't medical advice, this is education, and you always need to be responsible for your own care in here. So my default is always, none of this should hurt, okay? It should feel good, it should feel stretching, but none of this should actually hurt. Okay, so nerve massage. What I often tell people is if you have a pet, if you have a dog or a cat or an infant, and you stroke their nose to relax them, that's about the level of pressure that you want to use when you're working on your own nerves. Some of these spots I'm going to show you, you will recognize, especially if you're a headache sufferer, you'll say, oh yeah, I know that spot. I dig my thumbs in there pretty regularly. So if we are aggressive on these spots, the reason we get pain relief from that is probably because we are releasing our sort of endogenous painkillers that are within our own bodies. We're going to get some short-term pain relief from that, but we're probably also at the same time increasing the inflammation in the nerve itself. And that's the opposite of what we want to do. We want to be soothing the nerve. So we're stimulating it, we're attracting the brain's attention to that nerve, but we're doing it in a way that feels soothing so that it will relax and calm down and reduce its inflammation. So the trigeminal nerve pathway massage feels incredible. To be honest, it feels much better when somebody else does it for you than when you do it for yourself, but it still feels really good to do it yourself. So the whole face, the whole scalp, the whole jaw its input into the brain, its sensation input into the brain is coming through the trigeminal nerve. So any soothing massage, or just, you take extra time to wash your face at night, this is going to be soothing to your trigeminal nerve. But most directly to impact that nerve, there's a few outlets. And so this is my advice for trigeminal nerve massage, is getting in underneath your eyebrows here. There's this little notch in the brow bone, the supraorbital notch, and that's an outlet for the trigeminal nerve right there. You might notice if you're pressing hard in here, or for some people, even without a lot of pressure, it might feel a little bit achy, okay? If you get that achy sensation when you're pressing up into the bone here in this little notch, that means you're in the right spot. But we're not after achy, okay? So if it does feel achy, you want to back off and go even more gentle. If you feel like you're just running your fingers along the surface of your skin, that's totally fine. We don't need to be actually like massaging anything here. So this pathway, I usually spend a little bit of time, maybe 5 or 10 seconds. Sometimes I just pull the skin back and forth right above that notch. And then I follow the ridge of the brow bone out towards the temples. I do each of my pathways 3 times, just because 3 is nice. It feels predictive to the nervous system. The next spot is right here at the junction of the cheekbone and the nose. So same thing, a little bit of time here. Again, we're not using pressure necessarily. We're just doing this really gentle massage, maybe just moving the skin around, and then we're sweeping our fingers across the cheekbone and out to the temples again. The next spot is just to the outside of the nostrils. So if you come in here and I'm sort of poking at the bottom of my cheekbone right here, this spot can be quite achy as well. So again, if it's achy, awesome, you got the right spot, but also we're not looking for that to be achy. So a few seconds here. Again, you can pull the skin in any direction that feels good, and then you're going to follow out the bottom of that cheekbone out towards the ear. The next spot is just below the corner of the bottom lip. This one can be a little bit difficult to find on yourself. So what I tend to do is stack my fingers together in the center of my chin and then roll outwards. And this one on me is a little bit achy. I always get this little mini headache right here when I poke this side. So again, just nice, very, very gentle. I'm just going to spend a little bit of time there. And then I follow up the top of the jawbone towards the earlobe. Okay. So those are our pathways. And this is an amazing routine for bedtime. Wash your hands, wash your face. You can even just do this in bed. That's what I often tell my people, is just include your self-care in I need to go to sleep routine. It's very relaxing to your nervous system, will help you to sleep better, and hopefully will bring some of the inflammation down in the nerve so that you're not as likely to clench overnight. So that's our trigeminal nerve massage. When we get into trying to massage muscles of the jaw, the ones I most want to target are masseter and temporalis. So masseter is this big muscle that goes from the cheekbone to the bottom of the jaw. And when you clench your teeth, it's like a rock. You can usually see that pop up pretty good. And then the other one is temporalis, which is sort of this big flat muscle on the temples here that comes down and attaches to the top of the bottom part of the jaw here. And these ones you'll be familiar with from the tension that you feel in your jaw. So a couple of things I really like to do, you can actually just, get your fingers into that muscle belly. If you want to make sure that you're on it, you can clench your teeth, feel it pop up against your fingers, and then you can give yourself whatever kind of massage you like here. I really like to do little circles. And I can sort of travel the distance from the cheekbone down to the top of the jawbone right here. I don't go down under the jaw when I'm working on masseter because we do have some sensitive structures in here. So if I'm going to do that, I'm going to do that super gently and just by stretching the skin. Same thing with temporalis. You can get this big flat muscle here if you put your hand gently on the side of your head, just above your ear, and clench your jaw. You should feel the tension increase here. So same thing. I do like circles for temporalis. You can use the whole hand to do this if you want to. I'm kind of using like the base of my thumb here to give that a little bit of good feeling pressure. I'm not producing pain for myself here. I'm just doing this at the level that feels really soothing. One of my favorite things to do for jaw tension, and really tension in a lot of places in the body, is to take the skin and stretch it. When we hang onto the skin and we stretch it in any direction that feels good, and we're going to activate stretch receptors within the skin. And this is part of our sensation that goes from the skin into the brain. The stretch receptors reduce pain once they've activated. So they'll sort of dial down the receptivity, like turn down the volume knob on the other pain receptors that are present there. So just stretching the skin can be incredibly powerful for reducing muscle tension. When we get less pain in the area, we get relaxation. So a nice way to do this is you can do this on both sides of the jaw at the same time, but if you take your fingers into the skin at the base of the jaw and just really slowly drag up, we want to kind of take 90 seconds. Our stretch receptors peak around 90 seconds of hold. So we want to take our time with this. But one of the things I like to do is just slowly drag my fingers up from the bottom of the jaw. I'm going to go all the way up to my temple. And same thing, nice and slowly. I can stop anywhere that feels good. If I feel a little bit of tension there that I want to address, I can just hang on there for a little bit. I come all the way up. I usually come all the way up into the hair, and I like to grab onto the hair and pull and hold. So I'm getting this skin stretch in through the side of the skin here. So if you can take 90 seconds to do that whole pathway, that's fantastic. So I like to do it with the jaw closed, not clenched, but closed. And then I like to do it again with the jaw open. So at whatever position feels good for you to hold your jaw open, you can go ahead and do that again. Another thing that can feel really nice is when you get to a spot that does feel like it has a little bit more tension. I often find this right under the cheekbone and right above the cheekbone. I can hold that there. I'm stretching my skin upward. I'm not putting a lot of pressure into the muscle. I'm mostly just holding the skin in place, and then I can gently open and close my jaw a few times. Notice I'm doing this slowly and relaxed. Every once in a while when I'm working on somebody, I ask them to open and close their jaw, and they do it like this. Those people tend to be holding quite a lot of stress in their jaws. So we're not after a really aggressive movement here. We want to do everything in a way that's really soothing. So those are a couple of my favorites. The other thing that I often find myself doing is just taking the skin at the base of my jaw, and I'm just pinching the skin and pulling and holding. So you can kind of take that roll of skin and move it across anywhere that feels good if you want to, or you can just kind of pinch and hold in place. And this will give you that skin stretching effect as well, and relax things. So that's one that I do quite often. For myself, I just kind of work along the whole base of the jaw, pulling the skin into this sort of big fold here, and rolling it or just holding it and pinching it. And the other one that I'll often do is put two fingers beside each other, little space in between them, and then twist one down and one up. And again, hold that for a minute and a half. You can go whatever direction feels good. This feels really nice over top of masseter, and also really nice on temporalis. So that's one you can do regularly. Another really effective way to increase relaxation at the jaw is to work with the ear. So there's, ligaments that connect from the ear into the jaw. So often if we take the ear and pull and hold, we can get a little bit of that skin stretch here, but we're also working through some connective tissue. People with jaw dysfunction usually feel this in the jaw when you pull and hold the ear. Working on the ear itself, massage at the ear is incredibly soothing for the nervous system. You've got a lot of vagus nerve interaction from the inside of the ear and the skin behind the ear. So if you want to target some massage at the ear, I like to take 2 fingers like this and rub behind and in front of the ear. This is incredibly soothing. And the other thing I'll do is get my finger in to the Simba concha here, and I mean, none of this stuff needs to be super precise. If it feels good to you, you're doing the right thing. But this little spot right here is very, very connected to the incoming nerves from the branches from the vagus nerve to the brain. So some gentle pressure here or some little circles inside the ear is really, really soothing. It's going to be great for the job. It'll be great for your nervous system overall. Okay, so speaking of the vagus nerve, a couple of easy vagus nerve exercises that I really, really like. I do these daily. They make a big difference for overall relaxation in the body. And because we've got this body to brain, brain to body connection, if we can increase our overall sense of relaxation, we're going to get some benefit of relaxation at the jaw. If we can reduce our jaw tension, we're going to get some overall relaxation throughout the body. So the basic exercise is a way to target the vagus nerve. It's very easy to do. You can do it seated, standing, laying down, in any position. The key is you're going to hold your head still while you move just your eyes. So what I usually do is start with my fingers at the base of my skull, both sides, just because it feels nice. There's some good vagus interaction there. And then I put my hands on the side of my jaw so I can tell if I'm trying to push one way or the other while I move my eyes. Try to keep my shoulders down while I'm doing this. And then all I'm going to do is hold my head still. I'm going to take my eyes and look to the side. I always start with my right side because it's a little bit easier for most people. And I hold my gaze over here while I take some nice relaxed breaths, exhales, really nice and long and conscious. And I wait for a response from my vagus nerve. So the responses we're waiting for are a yawn, a swallow, or a sigh. That sigh feels like an extra inhale of breath. It's the relief sigh, the double intake of breath and long exhale. Initially, when you start doing the basic exercise, you might not get those responses right away. That is fine. You'll start getting them if you stick with this. The nervous system loves consistency. The more we do things, the better they get. So what I typically tell people is give it a minute each side. So you're going to do your right side. And then once you get your response there, or you've waited for a minute, you come back to center, and then you're going to go to the left. The left is usually more difficult for people than the right. That's fine. You're going to wait there on the left until you get your vagus response, or give it a minute, and then come back to center. If you try this and it feels soothing, great. Keep doing it. Twice a day is great. More times than that is even better. If you start doing this and you hate it, don't bother. There are other ways to stimulate your vagus nerve. This is only one of them. One variation that often seems to help people is holding the head still, and instead of looking to the side and holding, is just moving the eyes slowly from one side to the other. And I usually do this with my breath. So I would inhale to one side and exhale to the other side, and go back and forth for about a minute or a minute and a half. That's often more soothing to people than just holding that gaze. So give it a try. If it's not great for you, it's fine. There are other ways to do this. A couple of stretches I really like. So these aren't specific jaw muscle stretches, but they deal with a lot of the tension that accumulates in the muscles around the neck and the base of the skull. I will say stretching is not the solution for everybody. Some people benefit a lot from stretching. Other people, I'm one of them, I have a lot of muscle tension, but I also have very mobile joints. So stretching doesn't necessarily get me a whole lot of benefit. However, it's still worth trying. I always recommend that people try stretching and see what it feels like to them. If you don't get benefit from it, we're going to do something else. But if you do get benefit from it, it is simple, should be done regularly. All of these things, the more often we do them, the better they're going to work. So my favorite ones here for sort of overall tension around the jaw and the neck and shoulders is this neck lateral flexion and rotation. So what we're going to do here is bring the ear towards the shoulder. So you want to keep both shoulders down. I tend to either sit on my hands, or I'll, the shoulder I'm working on, I'll actively pull that shoulder down by stretching my hand down and away. And I bring my ear towards the shoulder on that side. I totally did this wrong. I'm going to stretch the arm that I'm working on down and away and bring the ear towards the opposite side. So I'm getting this nice stretch through the side of the neck. This is great. You can hang out here. You can hold this for as long as it feels good to you. But what I really like to add to this one is bringing the chin down towards the opposite shoulder. And I often feel this stretch more intensely through the back of my shoulder and neck. And then bringing my chin up towards the ceiling on the side of the body that I'm working on. And I typically feel this stretch more along the front and side of my neck. So you're basically doing a full 180 with the head, but you're doing it with your head to the side. And this movement, head to the left, rotate to the right, can be weird for people to start with. So if this is feeling really awkward to you, I would actually start with that one. So head to the side, rotate up. Most people find it pretty easy to get this movement happening. So I really like that one. You can stretch and hold, you can move with your breath, whatever feels better for you is going to be the right way to target these muscles. Chin tucks, I like this in a couple of ways. So when we want to stretch the muscles at the base of the skull, which are often involved in jaw tension, often involved in headaches, if we just bring our whole neck forward like this, we don't get a lot of stretch to those muscles, tiny little muscles at the base of the skull. We will get the overall muscles at the back of the neck, which is also great. But to get these guys specifically, we need to make sure that we're bringing our head backwards, so towards the back of the body, and then tucking our chin towards our throat. You want to achieve as many chins as possible when you're doing this move. So head back, chin down. And sometimes I don't feel this right away. So I'll, even once my chin is down, try to slide my head backwards on my spine a little bit. So I can feel a little bit of stretch right at the base of the skull. You can do this as a stretch. You can do it and add a little bit of force as well. If you bring your head back, chin down, and there's something behind you, like the headrest of your car, a pillow on your couch, if you're laying on the floor, you know, yoga mat, something like that, and then pushing backwards into this position often feels really, really good. You can also, if you like the scalp stretch that you get when you use the hair, you can use your hand in the hair at the base of the skull. So when your head is back, chin is tilted, you can kind of bring the skull farther down, like we're rotating the skull on the spine like that by using the hair to pull. And now too, you're getting that skin stretch across the back of those muscles there as well. One of my favorite ways to combine breathing and this movement is a breathing exercise that will be really, really good for your vagus nerve as well. So if I'm going to do that one, I just call it head nod breathing. I don't know what it's actually called. On my inhale, I'm going to bring my head back and chin down. So inhale here, and then I hold my breath here for a couple of seconds, only as long as feels comfortable. And on my exhale, I come back to center. So my inhale comes down and back. Nice full breath. I hold that and then breathe out to come back to neutral. That's one of my favorites right now. I find it incredibly soothing. I find it really great for tension at the back of the neck and the base of the skull, and it's really effective for my vagus nerve. Okay, so that's a transition there from the chin tucks into breathing. We could spend a lot of time on breathing. If you've never done any breath work, there's a lot of resources online if you want to take a quick course on sort of how to breathe properly. And it seems like such a dumb thing to say, like, oh, you're just not breathing right. If you breathed right, then, you know, be fine. It's like we're all adults and we don't know how to breathe and walk and hold our tongues in our mouths and things like that. But many of us don't actually use the proper muscles for breathing. I mean, we're using them, but we're not using them maybe to their full capacity. So one of the things I really like for this is getting into a position where my diaphragm finds it easy to move fully. So anytime we breathe, we're using our diaphragm, right? So when we say diaphragm breathing, we don't mean to imply that you're not using your diaphragm at other times, but your diaphragm is maybe not getting its full travel. So one of the ways that I find easy to target this is if I'm laying down flat on my back, I'll put a pillow underneath my upper back. So the pillow starts at the base of my shoulder blades and then goes up and supports my head. So my spine is just a little bit arched forward when I'm laying on the ground. Arms can go where they're comfortable, and then a few deep breaths into the body. You can achieve the same thing when you're sitting, and this is an easy way to tell how your breathing is compromised. So if you curl your body forward like this into this really slouched position and try and take a full breath, you'll notice how restricted it is right away. But the same thing if you arch way backward like this, sort of as far as you can, compressing that low back and through your thoracic spine, and try and take a full breath there, you'll also notice that you're limited. So what I like to do is find a fairly neutral, comfortable position in my pelvis. So my hips are fairly neutral, and then just think about taking my sternum and lifting it just a little bit. So I'm not really arching through my spine that much. I'm just sort of lifting through the sternum, expanding my rib cage a little bit. And then my breathing here feels much fuller, way less restricted. So that's one of the ways that I like to relax my breathing, use my full lung capacity, and let my diaphragm have its full travel. So, we could talk about breathing forever. And there's a ton of benefits. Like if we all just laid on the floor and breathed really well for 5 or 10 minutes a night, I think we would notice significant decreases in our stress responses and probably in our muscle tension as well. Okay, next, stability. This is one of the things I recommend to a lot of people because, especially for those people that stretching isn't very helpful for, it might be more that the neck itself doesn't feel stable. So one of my biases is that stability needs to be present in order for the nervous system to be okay to reduce tension. If a joint doesn't feel stable to your nervous system, the brain is always going to activate muscles, make them tighter, tenser to try and stabilize that joint, because an unstable joint feels bad. It feels scary to the nervous system. So working on our neck stability can dramatically improve the regular chronic tension that we carry at our neck and shoulders. The easiest way I like to do this is just with a little bit of isometric exercise. So I get my neck into a fairly neutral position. I want to be seated fairly comfortably. You can do the standing as well. Fairly neutral position. So my head's not way forward. My head's not way back like this. With my hand on the side of my head, I'm going to push my head into my hand, but I'm going to match that force by pushing my hand back into my head. So I'm not moving, though that is also an option to do this. I like to start with this so we can really learn these techniques well. So hand on the side of the head pushes into the hand pushes back. I start off with using like 10%, 20% of your force maximum. We're not trying to make this really aggressive, but I'll do that, sort of slowly increase tension to about 20% of my strength, hold that for maybe 5 seconds, and then slowly decrease that force till I come back to nothing. I do both sides, forward, back, and rotation is great as well. We've got time to spend another couple of seconds here. So now I'm trying to rotate this way, but I'm blocking that rotation with my hands. So trying to turn my head, stopping myself from doing that. Same thing, slowly increase force over 3 to 5 seconds, hold for about 5 seconds, and then slowly decrease that force so that I'm not letting it go really dramatically. I find that stressful on my body if I push really hard and then just suddenly let go. It doesn't feel very good, and I don't tend to get the same benefit from it. So I like to start with that really simple exercise, and then as we get better at that, we can start doing this in different positions. Maybe I'm going to start here instead of neutral, and I'm strengthening these muscles in a different position. So lots of options and variety for that as well. Okay, a couple more jaw specific exercises, and then we'll be done. So one of the really great ones to teach the jaw how to move in a central way, again, if our jaw doesn't move in a central way. So often when people open their jaw, you'll notice that the jaw sort of moves off to the side and then comes back. So we'll get this kind of movement, or it goes both ways like an S. So it'll start this way and then come back. And often it's quite aggressive feeling when it does that. I'm doing it quite slowly and deliberately, but some people, they open their mouth and they can't stop the jaw from being pulled back and forth. So that's one of those abnormal movements that we'd like to eliminate if we can. So a really great way to do this is this jaw opening exercise. So if you take your tongue and touch it to, we're going to start on the hard palate. So right behind your top teeth, right here. So you're going to put the top of your tongue there, the tip of your tongue, and then you're going to curl your tongue backward across the palate until you hit your soft palate. Once your tongue is back at the soft palate, it's going to be curled like this. Then you start opening the jaw just a little bit until you feel the tongue start to pull away from the palate. Do this in a mirror so you can see how centralized your jaw is. So my jaw is pretty central. So when I do this activity, you can see that my jaw moves quite sort of straight up and down. Notice I'm not getting a ton of opening there. I'm not like, that's not as far as I can open my mouth. But for some people, when they do this with the tongue in the center of the soft palate, they'll notice that their jaw is going way to one side or way to the other. Now, if we take our tongue, tip to the hard palate, curl it back to the soft palate, and then we move it side to side, that will affect the positioning of the jaw. So when I take my tongue to my soft palate and I move it all the way to one side, you can see what happens to my jaw. So I'm going to bring my tongue to the right side of kind of like back by my back molars. So now I'm getting this over to the left, over to the right sort of wobble happening in my jaw because my tongue is in a different position. So your goal with this exercise is find the position of the tongue that makes your jaw stay central. So for me, that's central. But for a lot of you, you're going to notice that your tongue way to the right or way to the left forces your jaw to move in this nice, smooth, centralized up and down. So once you find that position of the tongue, you do this every day, morning and night. Do it 3 to 5 times. I suggest when you're brushing your teeth, and keep watching until you notice that with your tongue in your same position, your jaw has started to move away from centralized. Okay, so say your tongue's all the way to the right, your jaw is moving nice and center. Maybe you do that for 5 or 6 days, and then you notice, oh, my tongue's still in the same position, but now my jaw is starting to move to one side or the other. Now you're going to find a new tongue position that keeps the jaw central. And your goal is to get to centered tongue, centered jaw. Okay, so you just keep moving the tongue for a variety of positions throughout the mouth. Whatever makes your jaw move the most smoothly and the most central, that's where your tongue belongs for this exercise. And then you keep doing it every time you brush your teeth, 3 to 5 times until you get to the point where your tongue is centered and your jaw is centered. You should notice by that point that your regular jaw clicking, grinding, wobble has reduced significantly because we've basically taught the jaw how to move again in a proper way. For some people, a resisted open and close at the jaw is really helpful. I tend to go more for resisted open than resisted close. Most of us are very good at bringing our jaw upwards because we've got these really powerful clenchers that do that all the time. But we might not be very good at forcefully opening the jaw. So for this one, you're going to put your hands on the bottom of your jaw, however that feels comfortable to you. And then you're going to, everything else is staying still, but the bottom jaw is moving downward against the resistance of my hands. So you can slowly open while you resist, or you can hold your jaw completely still with your hands. So you're matching the force from the hands to the jaw again. And I'm just trying to make that happen. I do this the same way I did the one on the side of the head. Slowly build tension for 3 to 5 seconds, hold it for about 5 seconds, and then slowly back off of that. I would do this maximum 3 times a day, as long as it's feeling good. If you do it once and it feels fine, you do it a second time and it doesn't feel good, just stay with once for now. And then one of my favorite exercises for the jaw, which can be surprisingly challenging, is what I call the slack jaw exercise. So if you can picture, I hate to be ageist about this, but teenager on their phone, right? With the just like slumped shoulders, head forward, jaw just hanging open. We don't want to be in this position all the time. That's not what I'm advocating. But if you can practice not opening your jaw with force, but letting your jaw fall open with relaxation, this sort of like, I often sigh gently when I do this. So I'm breathing out like I'm saying the letter H a whole bunch of times. I can't do it without closing my eyes either. So I'm trying to just let the jaw fall open. That movement 4 or 5 times often really changes the way my whole body feels. Often if I'm out for a walk and I notice that I'm clenching somewhere, if I do this slack jaw exercise 4 or 5 times, it often reduces body pain in other places too while I'm out for a walk. And so that exercise I love for right before bed, but you can do it anytime when you're feeling tense. So what I typically advise for people to start is a twice a day routine. First thing in the morning and right before you go to bed is great. But honestly, some is better than some is better than nothing. So if you only do it once a day, that's great. If you do it once every other day, right, better than never doing it at all. So before bed, the trigeminal nerve pathway massage. So this facial massage that comes under the eyebrows, under the eyes, under the cheekbone, and the top of the jaw. Each of those pathways 3 times, both sides of the face. We do that one. We do some kind of vagus activation, whether it's a basic exercise or this head nod breathing. Inhale, hold, exhale. And we do some kind of jaw self-massage, whether it's this skin stretch one all the way up from the jaw to the hairline, or specific muscles of the jaw, and then a slack jaw exercise 4 to 5 times. This shouldn't take you more than 5 minutes. If you're already in bed and you're trying to fall asleep, this is going to help you to fall asleep and sleep better anyway. So you might as well just build it into that go into bed routine. And just as a demo of what slack jaw looks like, if you haven't seen this movie, highly recommend. This is Napoleon Dynamite, and this is a perfect slack jaw position. So again, we're not doing this all the time, but this is our just let that jaw be able to fall open. Practice that. Contact info is here. LanaThompsonMassage.com is the website. There's a post there on jaw exercises as well, if you prefer to see things typed and written out. Please feel free to email me if you have questions about any of this. And I'm at Riverside Sports Therapy in Cochrane. So if you're interested in booking for massage for whatever is going on for you, for jaw work, I'd be delighted to help with that. So you can book with me there. But again, you don't have to book with me in order to benefit from this. I hope these self-care exercises are really helpful, and I'm always happy to answer questions. So please feel free to get in touch with me at any point, and good luck with the jaw tension. I hope that you notice changes to your jaw dysfunction and other conditions in your body as well. If the symptoms of other conditions improve as you get this relaxation of the jaw, that's ideal. That's the thing we're really going for. Okay, thanks for your attention. And again, don't hesitate to get in touch. Bye.